Hi, I'm Dr. Starlyn Hawes, a licensed clinical psychologist with over 18 years of experience in health and rehabilitation psychology. I help people with health conditions adjust and live more fully through collaborative care, family support, and education that transforms understanding into action. My journey began in academic medical centers. Here's what changed everything. While patients valued our work, they shared that receiving care in the same hospital where they'd had their most challenging days felt re traumatizing. That feedback deeply resonated with me and led me to establish mindfully balancing wellness in the community where you're actually doing life. For over 9 years, I've provided care outside of hospital settings. And I'm also an empowerment health coach offering holistic support through the menopause transition. What makes my approach unique is that I combine evidence based psychological expertise with a deep understanding of mental health within the context of health, different menopause pathways, healthcare barriers, and how cultural identity shapes experiences. I also happen to be navigating this transition myself. Mine started postpartum with my second child. I also understand why finding someone who truly gets your experience matters so deeply. I founded my practice because you deserve care that honors your whole self, your personal history, cultural background, professional aspirations, physical well being, and more. Whether through psychology or coaching, my mission is helping you move through the menopause transition with clarity and personal power. Knowledge is critical to that power. I respect the many challenges that come with adjustment, and I work to help you find meaning in both the journey and your hoped for destination. My approach weaves together clinical expertise, diverse experiences, and cultural sensitivity to help you discover your most empowered path forward. Today, I'll be talking about facilitating your empowered perimenopause. So, before we dive in, I just want to cover a few disclaimers by letting everyone know this talk is really for informational purposes only and does not contain therapy or clinical advice. Please be sure to contact your physician or qualified healthcare provider with any questions regarding your health. This second item is just letting you know that information does become outdated at a certain point, so please be sure to keep that in mind. And although this presentation is brief, all things considered, it's impossible to cover every single point about every single thing that might be touched upon, but it is meant to hold space for everyone. And nothing is meant to exclude or minimize anyone's unique experience. We are missing out on important health education. And I think that's a big reason you might be here today. With that said, as of 2022, only 6% of women surveyed felt prepared for perimenopause. 69% don't recognize symptoms, and 92% want more education. However, 100% of us will experience perimenopause and eventually menopause. So let's talk about what this transition can look like. Imagine waking up one morning and not recognizing what's happening with your body. Yesterday, you felt great. You were walking in your power. You were having the kind of day where you were thinking, bring it on, because you knew nothing was going to derail you. That night, you fall asleep peacefully until suddenly you're hot. Not just regular hot, like heat rushing up from the inside out. You're sweating, restless, throwing off the blankets. Minutes later, you're cold. So you put the blankets back on. You finally get back to sleep, only to wake up drenched. Your heart racing, your sheets soaked from all of that sweat, and your body confused. You wonder what's happening. Is this a one time thing or something more? For many of us, this very well might be an example of how perimenopause begins. Without warning, without a roadmap, and often without the support we need to understand what's happening. I'm here to tell you, you don't have to navigate this alone. So here is our roadmap for today, so you have a sense of what'll be covered. One of the first things we'll do is try to lay a framework for helping you understand what's happening to your body and mind during perimenopause and menopause. We'll also explore how race and culture influence this experience. We'll also look at mental health, work, relationships, and healthcare considerations. Last but certainly not least, we'll also look at self-care and self-advocacy strategies. So what's really going on during perimenopause and menopause? Let's take a look at this visual. On the left, you'll see hormone patterns during 6 months of regular cycles. Regular can look different for everyone, but this is the premenopausal phase. The middle image shows perimenopause, often called a hormonal roller coaster. It typically begins in the mid 30s to the late 40s, but it can start earlier due to genetics, health conditions, or medical treatments that affect the ovaries. You see that estrogen, the dark green line, is all over the place. And that is part of the reason women develop symptoms like hot flashes, night sweats, mood swings, brain fog, and the unsettling feeling of not quite recognizing themselves. So it's important to define menopause, and that is defined as 12 consecutive months without a menstrual cycle. After that, you're in postmenopause. This is a stage where estrogen and progesterone remain at low, steady levels. And to be clear, once you're in menopause for the rest of your life. This is what is also referred to as postmenopause. But it's important to know that this transition, it's not just physical. Your mind is going through changes too. It's recalibrating each time. Your hormones aren't following a rhythmic, predictable pattern. And this is part of the reason why symptoms develop in perimenopause. So the science behind this is clear. During this time, your brain and your body are navigating a complex shift. As your hormone levels rise and fall, your brain is adapting, trying to evolve in ways that support you in this new phase of life. This process impacts both our physical and emotional well being. Our reproductive transition from puberty to menopause is very much a natural process. However, suffering is not. Everyone's path through menopause is unique. Symptoms don't happen in a specific order, and they don't always make themselves obvious at first. Far too often, it's simply not talked about. Worse, many healthcare providers aren't trained to support us through this stage, and that can leave us feeling confused, isolated, and misunderstood. To gain a more well rounded view of what's going on during menopause, let's look at it through the biopsychosocial model. This slide has a lot of information, so please bear with me. As a health and rehabilitation psychologist, and also in my work as a coach, I use this model to understand what people are going through. In short, you're a whole person with many parts of your life affected by this transition, and you deserve care that reflects that. So, biologically, the hormonal ups and downs during perimenopause and menopause can lead to a wide range of physical symptoms. Some might be silent, like shifts in blood pressure or bone density. Others are subtle, like changes in your menstrual cycle or how your body handles insulin. And some are disruptive, like joint pain or poor sleep. Psychologically, this stage of life can bring mood swings or trigger symptoms of anxiety and depression. Many women also describe brain fog or mental fatigue, which can affect how you show up at work and at home. Socially, menopause still often has stigma surrounding it. Thankfully, more conversations are happening now, but there's still a long way to go. Whether it's in your relationships, at work, or with your healthcare providers, many women still don't have the information or support they need to feel confident during this time. It's important to understand that race and culture can shape how we experience the transition through menopause. Along with everyone else, white women tend to experience hot flashes, mood and weight changes, and sleep disruption. However, research shows that Black women often begin menopause earlier than white women and tend to report more intense symptoms. They also face higher risks for issues like heart disease and sleep problems, yet these concerns are often underappreciated by healthcare providers. Now, this ties into a bigger picture, the role that race plays in both the healthcare system and our everyday lives. Many doctors and nurses report not feeling fully prepared or trained to adequately treat women during the menopause transition, let alone recognize how menopause may show up differently for women from diverse backgrounds. That's why it's so important for each of us to be informed so we can speak up and advocate for the care we need and deserve. Similar to Black women, Latina women also tend to enter perimenopause and menopause earlier than white women. On average, they experience hot flashes for about 8.8 years, longer than other groups. However, Native American and Black women experience them longer on average. Many are the heads of their households, juggling multiple roles and responsibilities, and may not seek support or even realize that help is available. In some communities, Menopause is seen as something we're expected to handle quietly without complaint or outside support. Asian women may experience more symptoms related to muscles, joints, and the heart. Cultural values around aging and keeping certain struggles private can also affect how menopause is talked about or not talked about within families and communities. Unfortunately, those who may experience the most severe symptoms are often not represented in research studies. For example, Native American women may face the longest and most intense menopause symptoms, but there is very little data to fully understand their experience. The earlier you go through perimenopause and menopause, the earlier your body begins to go through changes like reduced bone density, increased body fat, reduced muscle, and higher cholesterol levels. That means that health risks like heart disease, bone fractures, and falls may show up sooner too. No matter your race or cultural background, we each deserve support, information, and respect as we go through this life transition. The more we know, the more we can care for ourselves and each other. It is understandable that uncertainty or changes would lend to concerns and or mental health challenges. If you're someone who's had mental health conditions in the past, like anxiety, depression, or mood swings, even if they were stable or had gone away, perimenopause and menopause can make them harder to manage or bring them back. And if you've never had mental health challenges before, this stage of life can sometimes trigger new symptoms that look like anxiety, depression, ADHD, or even memory problems similar to dementia. In some cases, you might receive your first mental health diagnosis. It's important that healthcare and mental health care providers understand how much hormones can affect your mood, focus, and brain function. That way, your treatment plan fits your needs. Now, why does this matter? Because if your symptoms are assumed to be purely a mental health issue, your provider might offer the usual medications for depression or anxiety. Sometimes that's exactly what you need, and there is literature out there that suggests whatever worked for your mental health care conditions in the past should be the first line intervention if you represent during perimenopause with the same symptoms. But if your symptoms are linked to the menopause transition, you may also want to explore menopause hormone therapy as an option. Some women find that a mix of both treatments works best for them. At the same time, you always have the right to say no to medication or hormones. If that's your choice, be sure to ask your provider about other treatment options like therapy, lifestyle changes, or natural remedies. So, what can you do about all of the changes associated with perimenopause and menopause? Well, self care matters. This is a place where we do have some agency. So, earlier, we talked about the biopsychosocial model. And in that model, there are some factors we can't change, like age, genetics, and ethnicity. But there are also some modifiable factors that we can influence, like what we eat, how we move our bodies, how we manage stress, how we sleep, and how we set and maintain boundaries for ourselves. We are not helpless in this transition. We can empower ourselves through knowledge and intentional action. For example, regular exercise can help improve mood and reduce anxiety. It can also help us sleep better. There's also some research that has mixed findings that say exercise may help with hot flashes. There's individual differences here, and this might be sufficient for you, but there might be some of you who feel they need and want something more or different to manage hot flashes, and that's perfectly fine. Meditation and mindfulness can help you stay grounded during emotional ups and downs. Healthy boundaries and refined goals can help you adjust as your identity and needs shift. Tapping into your support system can also be helpful. Your village might be just what you need during this time. It's also important for me to note that not everyone feels as though they have access to the support they feel they would benefit from, and that can certainly present challenges. So, with that in mind, please know that you can also seek out support from a mental health provider or a health coach who's informed about perimenopause and menopause. Meeting with a coach can also be helpful when you don't have a mental health diagnosis or you don't want to work with a mental health provider. They can also offer suggestions for healthcare providers to connect to. And many of us offer good referrals so you can gain access to helpful sources of support. Complementary approaches like acupuncture or massage therapy may also support your well being. This is a time to try to lead with curiosity and self compassion, not self judgment. There's more than enough stigma around this already, so try not to add to it by being hard on yourself. And remember, you bring strengths to this experience. Try to tap into them. You don't need to perfectly manage every moment. This process will ebb and it will flow. But over time, you may find yourself riding the wave with increased ease. During perimenopause, many of us are juggling a lot. If we're working, we're often at the peak of our careers, and at the same time, we might be raising young children, which is a very different load from parenting in the empty nest phase. We might also be caring for aging parents. And in 2022, 80% of survey respondents said menopause symptoms burden their family life. So here we are, juggling all of these things, and we're still thinking about how we and what we're going through is a burden to our family. It would be understandable if you said, hard stop. I need to reassess, and whatever you need that to be. Feel free to take a moment to think about what you might need that to be. And to be honest, it's more therapeutic and impactful if you give yourself permission to put pen to paper and write it down. Work is also important too. And for those of you who don't have traditional careers, your work is very important as well. Work can be challenging. A 2024 survey found that 79% of respondents were concerned about sleep issues, and 78% were struggling with brain fog, concentration, and memory. In addition, 1 in 4 didn't pursue or considered not pursuing a leadership role because of their symptoms. 1 in 3 reduced or considered reducing their workload. And 2 in 5 considered changing or changed jobs or career ambition due to perimenopause or menopause symptoms. So, perimenopause and menopause affect more than just our personal lives. They impact our professional lives too. Symptoms can make it tough to stay focused, be productive, or even get through the day. So, here are some work related self care strategies for managing symptoms. First and foremost, it's important to prioritize sleep. And when doing that, practicing good sleep hygiene whenever you can is helpful. Brain fog can trip us up and make us question ourselves. So, if your brain isn't cooperating, try taking a few deep breaths, pause, and try to figure out the next best steps. Using external tools to support your memory can also be pretty helpful. So, things like note taking apps for task and project management can give your brain a much needed break. And it can also help you to be sure you've got what you need when you need it. This may not be the best news, but it could be the perfect excuse to give yourself permission to try to graduate from multitasking. Your brain might very much appreciate the focus. Strategic use of breaks can also be really helpful. So you can use those breaks to hydrate, eat, stretch, take a walk, address other care needs, and help you gain a better pace for your day. Hot flashes are another part of the possible work experience. So, a few things you can do to prepare on that front is dress in layers so you can adjust. Keep extra clothes on hand in case you need to change. Pack cleansing wipes and deodorant. You might choose to wear your hair up, and if not, you might bring a hair tie or pin to keep your hair off your neck. If you know what your hot flash triggers are, then you can also plan to try to avoid them. The other thing that can be really helpful is to bring a cold pack with you or a small battery powered fan. An understandable question might be, okay, well, what if these strategies aren't enough? So, if they are not enough, you might need to advocate for your needs at work. Some organizations have menopause friendly policies. However, that may or may not be the case. But a good first step could be to check your employer's policies to see if there's already some resources available as a starting point, and then you can go from there. Let's take a moment to talk about the importance of partner support during the menopause transition. It can feel isolating, and having a partner who's tuned in and supportive can really make a difference. Before I dive into this, I want to address the partners who may be thinking, I don't even recognize my partner anymore. Here's something you might not know. Your partner might not always recognize themselves either. It's not uncommon for us to feel like we don't even know who we are during this time. For those of you who are out there feeling this way, you're not alone. Here's a quick explanation. Your brain is essentially being remodeled during the menopause transition to support you in this new phase of life. This remodeling is something that some of us breeze through, and for others, it can feel mildly to severely disruptive. In fact, according to a 2022 survey by the Family Law Menopause Project, 73% of respondents said menopause contributed to their relationship challenges or even divorce. And 1 in 5 sought support but didn't initially realize how perimenopause or menopause was impacting their relationships. So, this might be helpful to keep in mind. If you're in a relationship, open and honest communication with your partner is important. Consider asking for emotional support, whether it's a hug, a listening ear, or just understanding you might be a little more irritable than usual. You might start by naming that you've been experiencing changes due to perimenopause and you'd like to see how you can come together and support each other through it. So, a few topics that might be helpful to discuss is the possibility of learning about perimenopause and menopause together. It could be helpful to note that you realize it impacts your partner too. And for the record, a 2022 survey revealed that 88% of people going through perimenopause or menopause reported that their partners would be perceived as more supportive if they learned about this too. It could also be helpful to talk about your mental and emotional load and changes in physical intimacy. Support can also mean asking your partner to go with you to doctors, coaching, or therapy appointments. If your partner learns about this transition alongside you, they'll be better equipped to support you in the long run. Remember, this is an opportunity to turn towards each other. It can strengthen your relationship and help create more compassion and closeness. For those who are not partnered, many of these strategies can still apply to your family and friends who are supporting you. They can also help you feel heard and understood. Please keep in mind professional sources of support and support group as additional options. Let's be honest, you might have a number of doctor's appointments. Matter of fact, women tend to see an average of 4 doctors before receiving helpful perimenopause or menopause care. Too often, women feel dismissed or misunderstood when they bring menopause related concerns to their healthcare provider. Sometimes symptoms are brushed off as just aging. And while aging does play a role, menopause specific symptoms deserve focused attention. So let's talk about how you can prepare for appointments. One thing you can do is keep a log of what you're experiencing. So, hot flashes, sleep issues, mood swings, brain fog, menstrual changes can be a few of the things. So, tracking how often, intense, and how long they last can be helpful for providers. Okay. Another thing to keep in mind is writing down questions ahead of your appointment can be really helpful because you already know traditional appointments with doctors and nurses tend to last maybe 15 minutes. That is not a lot of time. So, preparing those questions ahead of time ensures that you get the answers to the questions that you have and allows you to make the most of your brief appointment. Knowing your goals going in can also help you to prioritize the time in your appointment. So, some other ways to have a more empowered stance in your appointments is to just internally remember that a one size fits all protocol does not fit when it comes to perimenopause and menopause care. Okay? Medication may help, hormones may help, Self-care strategies and lifestyle changes may help, but each one of those things might not be enough on their own. So, all that to say, it can be helpful to ask for a menu of options and also ask for the pros and cons of each option. That way, you're making a more informed decision about your care. If you've read something that resonated with you outside of a doctor's appointment, you have a few options. You can send the research to them ahead of an appointment and give them a heads up you'd like to discuss it, or you can consider bringing it with you, asking them to help you understand it or weigh in. You're also allowed to want and ask for collaborative care. So if you want to make decisions with your healthcare provider, make sure they're on board. You deserve to have a voice in your care. Another important consideration is if your current provider isn't knowledgeable about perimenopause or menopause, it's okay to ask for someone who is, whether it's a gynecologist, a functional medicine physician, a psychologist, a coach, or any other type of provider. It's okay to ask for what you need. Now, this other piece is really important, and no, it's not on the slide, but I'll walk through this with you. An important question might be, what if I'm being dismissed when I'm trying to advocate for my care? You have a couple of options. You might try asking for clarification, like, can you help me understand why this symptom isn't being addressed? Or you can also share how it's impacting your life. You might say something like, this is disrupting my sleep, my work, my relationships in these concrete ways. If they still don't listen or respect your concerns, you still have a few options. One is you can consider getting a second opinion, and this might also serve as your cue to trust your instincts. Sometimes even specialists might not be the right fit for you. So I think a key takeaway here is you deserve care that sees you, listens to you, and supports you. And I just want to encourage you to keep seeking that care because it is out there and you are worth it. As I wrap up, I want to thank you for taking the time for being here today. Perimenopause and menopause represent a complex transition. Today, I have barely scratched the surface, and there's always more to learn. My hope is that today sparked curiosity, clarity, and maybe even a little bit of relief. Remember, this transition is unique to each person. The more you're able to notice what's happening in your body and mind early on, the more empowered you are to seek support and improve your outcomes. Yes, this phase of life can feel like it upends who you thought you were, but it also offers a beautiful opportunity to redefine who you are today and how you want to show up for yourself and the people you care about. This is your chance to be intentional, to pursue knowledge, and to grow into a version of yourself that feels more grounded and connected. In doing so, you learn, you evolve, and you empower yourself to advocate, not just for your needs, but also for your wants. So, again, you don't have to do this alone. And you absolutely deserve care that's thoughtfully tailored to you. If you'd like to stay connected or learn more, I've included my contact information here. You can scan the QR code or type the web address. I'm able to support people nationwide in my coaching business and in 42 states in my therapy practice. If you prefer to work with me as a psychologist, but you're in a state that I'm not able to treat you in, I think it's important to know that I can offer education in my clinical practice nationwide. Thank you again for being a part of this important conversation. Please stay tuned for more. I do have a Q&A from a presentation I did earlier this year that we will likely include with this video, so please stay tuned for that if you'd like to. And if you found this helpful, please like the video, subscribe, let me know in the comments what topics you'd like me to explore next. I will do my best to create content based on your requests, and I also have a few ideas in mind of my own. Take care. Bye-bye.
Thank you so much, Dr. Hawes and Dr. Bell. And there are some questions that would like to address. And I personally learned a lot about menopause. Uh, it was very informative. Also needing to mention that men also will go at some point through the andropause, but later maybe in their 70s and 80s. And I don't think that they will be suffering as much or dealing with these conditions as women have. So it's good to have awareness around these conditions. And I really like the approach that you both had, kind of acceptance of this phase, not necessarily looking at it as a medical condition, kind of trying to embrace it and work with it and addressing the fact that everybody will be different in this journey and it's not a one prescription for all. So there are some questions here. The first question I think is for Dr. Bell. Many women after 40 years old, they start having some changes in their body, including weight gain, redistribution of weight, and difficulty losing the weight. In your opinion, are they related to the hormones, and what can be done to minimize these effects or actually improve these conditions?
Yeah, I mean, so one of the physiologic changes that does happen is that our basal metabolic rate changes. And then, as I said, that if we have lots of stressors, either regarding our symptoms or what happens to be going on in our life at that time, or even just that we've begun to have sleep disruption, that's enough of a physiologic disruption, is that the body then decides it needs to conserve because the stress response is there's an emergency, I'm going to have to run for my life, and I'm going to conserve and get ready. And so there are lots of things that we can do. So the big one is, what are all these stressors? How is my sleep? How is my mental health? What's happening in my relationships? How do I feel about myself, etc. And then some of the dietary things, I think, again, the foundation is learning what our metabolism is now that we've had these changes. And so, as Dr. Hawes talked about curiosity, we just begin to reflect on, what are the things where my body feels good? What are the things that I notice? Many people will say, oh my gosh, I have one cookie and I gained 10 pounds. What might I do differently? And again, not that you have to have a lot of restrictions. It's just you have to learn what kinds of things we need to do to change that. And I think, how we go about learning to make those changes are some of the things that Dr. Hawes talked about and what I was talking about self-care and mindfulness.
Is it okay if I add a little?
Yes, please.
Please.
Soundbite? I think one thing that's really important for us to know is you can have these changes even though you've changed nothing
That's
about
right.
what you're putting in your body, how often you're moving your body. So it's important to have providers who can normalize that part of it for you and explain it to you so that you can come at it from a different vantage point and maybe have a little more grace and patience with yourself and the process.
Exactly. I can't tell you, probably thousands of women who come in to see me sometime in their 40s or early 50s who say, I'm eating well, I'm exercising more than I ever have, and I'm gaining weight and I can't lose it. And that is just a very common thing that happens. And again, we're not stuck with that we're just going to have to be 10 or 20 pounds heavier than we were. I think that actually it's normal to be 3 to 5 pounds heavier from when you were 32 to when you're 55, and that is acceptable. That's a normal change. And more than that are things that we can explore to figure out how to stop continuing to gain weight and how to deal with all of the various aspects of our lifestyle to meet with where our body is at this phase in our life.
Wonderful. Thank you. And if I may add a little bit here, you both mentioned regarding mindfulness, exercise, being present, and taking care of individual, taking care of ourselves. I'm including myself here in this conversation as well. You're taking care of ourselves. One thing that you mentioned, Dr. Bell, was the adaptogens. When you were talking about the herbs, you mentioned adaptogens, ashwagandha. So one of the big hormones here is a big player is cortisol. The cortisol actually does cause a lot of fat redistribution in the body and weight gain. And it's really important that the stress that's causing by perimenopause and menopause, when people stress too much about this, that the cortisol level will go up. And then we get into this cycle that I'm stressing about something, I'm producing more cortisol. Cortisol is causing more inflammation in my body. I have more symptoms and I'm gaining more weight. So at some point, we have to break this cycle. So here comes the diet, the nutrition, the awareness of the condition, moderate exercise, and kind of like maybe modifying the diet if it's not the best diet and getting help. So just wanted to mention that the more one stresses about a condition, the more cortisol we may produce. And the role of these adaptogen herbs, including ashwagandha, is to balance that cortisol. But again, ashwagandha is not, it may not necessarily be the right adaptogen for every single individual. You have to see who the case is. Great, thank you. My next question is for Dr. Hawes. Dr. Hawes, we would like you to put your psychologist hat on and tell us a little bit what puts people at risk for mental health challenges during the menopause transition.
That is a good question. And I know I touched on it a little bit, but just to give a little bit more context, there are actually 3 windows of vulnerability that we experience. The first being puberty, the second being pregnancy, and you might have guessed perimenopause as another. This is where hormones shift more rapidly. So for individuals who may have experienced premenstrual dysphoric disorder in puberty, they're going to be more likely to experience depression and anxiety in perimenopause. Those who have a mood or anxiety disorder related to pregnancy or postpartum, same thing. Even a person who hasn't had a history of severe anxiety, experiencing hot flushes and night sweats can increase the odds of having anxiety. For example, people who have a history of things like abuse and neglect or family problems or poverty are also at increased risk during this time. We can talk more about hormones, but I know time is brief. So what I'll say is even though there are all of these additional risk factors to consider, many of the strategies we talk today hopefully help you feel like there's an opportunity to actually do things for yourself to better support yourself. If you know what to look for, then you can reach out for help sooner and your outcomes can be better. So
Yeah, and the one thing that I would add that I often say to people is that in this whole question of like, do I need hormone replacement therapy, is that for some people it can be helpful. For some people, it's just the explanation for what kind of flipped the switch to contribute to our symptoms. And so I think that's something to work out with an educated professional, but also it can be comforting to know, why is this happening to me? That concern of just feeling like why are you having this experience of these moods or brain fog or whatever? It can add to the problem. And if we can understand that the thing that sort of got it going was this substantial change, and that this is something that happens and that we can address, that in and of itself, by normalizing it a bit, can help us in the journey.
Wonderful. So we don't have much time, but I want to have two more questions, actually, if you can keep it very briefly. The next question is actually tied to the same question I asked from Dr. Hawes. The second part is, how do we make it more normal to have these conversations with others? You mentioned the study that people who actually have the symptoms or need help, or maybe it was Dr. Bell, are less included in the studies. So how can we normalize having these conversations in the community with partners and even one with themselves to kind of like having this internal conversation going through this period?
Did I jump in, or does Dr. Bell want to?
Then go ahead, Dr. Hawes.
Okay. First off, you get to decide when and under what circumstances you want to talk with anyone about this, right? It's your journey, your choice. But you can talk with friends, family, even your children, healthcare providers, whoever you want. With family and friends, it's perfectly fine to let them know you're going through something that's throwing you off. And you can ask them if they have the capacity to listen or even offer support versus just diving in. Once you have the green light, though, feel free to consider sharing that you are going through perimenopause, or you think you might be going through perimenopause. And it's really okay to invite them to learn about it with you. When you do that, it helps you speak the same language and you might feel more seen and supported. The only other thing I'll mention is I think healthcare providers can play a really helpful role by normalizing this, by routinely asking patients about perimenopause and menopause. Offering education and appointments might be brief, but sending them with resources that they can look up outside of the actual appointment can be helpful too.
Wonderful. Thank you. So there's an element of acceptance here that going through menopause, perimenopause, and menopause is not going to make me any less woman. So it is a normal process, and I should have this conversation. Dr. Bell, the next question is, are the suggestions that you had here applicable to someone with premature menopause, history of breast cancer, or menopause from surgery or cancer treatment?
Yeah, I think that all of those components are a further other thing to appreciate when we think about an individualized plan. So all of the things that we've talked about, well, except for maybe how we treat it with if we're going to use herbs or supplements, but all the lifestyle things are applicable. It's just that under these other circumstances, we may need more. So again, going through cancer treatment, knowing that you've had cancer, the process can add stressors both emotionally and physiologically that we have to address specifically for that. Similarly, for people who have menopause long before they expected it, people who have surgical menopause when the ovaries are just not there to be there for feedback, those can add additional things that need to be addressed. And I think that the point here is that, as you said, Dr. Maj, there is no one size fits all, and that it is important to know that there are certain things that you don't want to do in terms of treatment, not the lifestyle things, but treatment, if you have these additional factors in your health. But all the lifestyle things and all the other things that we talked about, exercise, mind-body things, are just as important and maybe even more so, given that there might be added stressors.
Is it okay if I add one little nutshell?
Sure, please.
A medically induced menopause is different than a natural perimenopause process. And so I think that for both you as the individual who might be experiencing it and for the providers who are treating you, it is exceptionally important to have the education that the symptoms associated with that might be, and very much likely will be, pretty abrupt. Yeah. So preparing you for that so that you know what your plan is, and you've hopefully been able to do that in collaboration with your healthcare team. So
yeah, that's a really good point. Really
that's
important.
An excellent point. Great. Thank you so much. It was a wonderful session. Thank you for the audience for the question and staying with us. And this, as I mentioned before, this is the first session of this 3-part series that we have regarding women's health. And number 2, number 3 will happen later. So kind of stay tuned, watch for the email coming. And in the next sessions, you have more opportunity for asking more questions. So with that, thank you very much. And I hope that you enjoyed the rest of this beautiful day in Seattle and Washington. Until next time, you take care. Bye.
Bye-bye. Thank you.